Hi everyone and welcome to the final instalment of our series on how to keep squash fit during the COVID-19 pandemic. This final episode explores common injuries that occur during squash and outlines ways in which you can reduce the risk of developing them. There's a number of areas that I'd like to cover, and I think you'll benefit more if I avoid skimming over the surface. Therefore, I've split this video up into 3 different components, which I'll release over the next 3 days. Today we will discuss common upper limb injuries. Tomorrow we will cover the more proximal lower limb, i.e. the hip and the knee. And on Sunday we will investigate more distally at the foot and ankle. Before I get started, I'd like to emphasise that the intention of these videos is to minimise the risk of injury. If you are currently suffering from injury, I would recommend seeking professional advice before performing any of these exercises, because injury and recovery is very unique from person to person. Both Alex Hodgetts and myself work for AJH Therapy, based here at Pontefract Squash and Leisure Club, and we'll be happy to help. So if you require any individual attention, please feel free to drop either of us a message. So I'm going to start today. The first common condition that I'd like to discuss is pathologies of the rotator cuff muscles. So the rotator cuff is a group of 4 muscles, the supraspinatus, infraspinatus, teres minor and subscapularis, which work together primarily to stabilise the shoulder, as well as assist in its rotation and elevation. Because squash demands a lot of rotation, as well as overhead movements from the shoulder, the tendons of the rotator cuff muscles are often affected, particularly in your over 45 age groups, where tendons are more prone to degeneration. It is rare without trauma to tear a rotator cuff muscle or tendon. However, most commonly the supraspinatus and infraspinatus may become inflamed as a result of overuse, especially if those muscles are not strong enough to cope with the demands placed on them by playing squash. An acute inflammation can develop into a more chronic tendinopathy if left untreated, and the resultant thickening of the tendon can subsequently result in the tendon becoming impinged between 2 bony surfaces within the shoulder, making rotational movements and overhead movements when playing squash somewhat painful within the shoulder joint. The purpose of the following exercises is to increase or improve the capacity of the rotator cuff tendons to cope with the demands and the strains placed on them when playing squash, and therefore minimise the risk of developing symptoms. So let's get started. So, first one I'm going to outline is to work on the rotator cuff tendons, but it's more to offload the rotator cuff tendons. It's what we call seated rowing. I'm going to use a piece of elastic TheraBand. Obviously not everyone's going to have access to a piece of band, but any small weights you can find, for example little dumbbells, anything like that to work on rowing is absolutely fine. So with your piece of band, you need to place it underneath your foot, keeping your foot rested firmly on the floor via your heel. And you're just going to work on rowing the band backwards. When we're performing this exercise, I want you to squeeze the middle bits of the shoulder blades together. I always like to prompt patients to imagine they've got an orange between the shoulder blades and to squeeze the juice out of the orange. And when we're doing it, I'd recommend not bringing the shoulders up towards the ears, because then that encourages strain in the shoulders, which obviously we want to avoid when we're playing squash. So perform a couple of repetitions, holding for 1, 2, 3, 4, 5, slowly lowering down. And again. Okay, so that can actually be quite a useful warm-up exercise before you start loading the tendons, because you are offloading them in the first instance. The second one that I want to work on is external rotation of the shoulder. Again, I'm going to use a band, but you can use, if you've got access to them, small weights at home, or if you've got bottles of water or anything like that, just to mimic a weight in your hand. So, with that piece of band, in that position there, we're just going to work on using one arm, stabilising at one arm, and then taking the band out to the side with the opposite arm, slowly returning down to the middle. Some people struggle to keep the elbow tucked in when we do this exercise, so maybe rolling up a towel and placing it between the elbow and the side could be a useful piece of technique. But we're going to take the band to the side, slowly return it to the middle. So here you're mimicking that backhand action, taking the arm out to the side and you're very slowly controlling it through. Always good for stability around the shoulder as well as isolating those rotator cuff tendons that we've already discussed. As with all of these exercises, I would recommend gently tucking in your tummy muscles at the same time as performing them, as I've banged on about in the previous couple of weeks. Because if you're stable here, you're stable in more of the upper limb and lower limb appendages. To progress this as an exercise, you can work against gravity. So by lying down onto the floor, and you can either have the band underneath your side or holding onto the band in your hand. Just wrap it around so you can see. And again, working against gravity, up against the band and slowly down. Up against the resistance of the band and slowly down. Just a little bit of a progression on that exercise. So that's that external rotation, mimicking your backhand. The next variation would be internal rotation, again using the band or the small weight. This can be a little bit tricky because you haven't got your hand on the right side. But what I like to do is find a nice stable surface, such as this cabinet, and do it in sitting. So I'm going to feed that band through there. And then from that position, band around the hand and pulling inwards towards the middle. Slowly lowering it back to neutral and in towards the middle. As with the external rotation, this can be progressed by working against gravity. So again, needing to be lying on your side, ideally find a floor that's a bit more comfortable than what I'm on at the moment. And again, lying on the band so it's got plenty of tension in it, band around your hands, and pulling that up towards the middle for slowly controlling down. So working up against gravity, slowly controlling down. Okay. So, those are very good for isolating those rotator cuff tendons. However, when we play squash, we don't load those tendons all the time, just down at this sort of hip height. We've also got a lot of volleys extending the arm, taking the ball high, and therefore it's good to load those rotator cuff tendons at shoulder height and above. So we're going to sort of transform those two exercises that we've just performed into a more shoulder height exercise, and the way that I like to do that, by stepping on the band, again wrapping around the hands as many times as you feel need to as far as tension goes, and bringing the arm up to that 90-degree horizontal plane. From there, lifting up very slowly, controlling and lowering down, keeping those tummy muscles tucked in as we did at the start. Slowly up, slowly down. I really like to emphasise with all my patients this slow eccentric phase. That's a really good way of loading up a tendon or a tissue. It's probably the most efficient way of strengthening it if you can tolerate doing it. Obviously that can be done with your light weight if you haven't got access to a band. So into the same position, performing the same action, and slowly down. In order to work on the medial rotation, so the internal rotation that almost mimics that forehand action, you're probably going to need an external force again that's quite high up on the wall. I'm lucky enough in here to have something that's fixed to the wall, so we're just going to work on that. So wrapping that band around the top. And then from there, we're going to work on pulling the arm down and slowly back up. So it's that same action working inwards, but we're now working at shoulder height, which is a little bit more specific to the actions we perform in squash. The other benefit of working slowly is that you're working on control, and obviously, as I mentioned at the start, The rotator cuff muscle's main role is to stabilise the shoulder, so the slower, more controlled you go, the more you are isolating those rotator cuff tendons. So, work into something a little bit more interesting or a little bit more engaging. Find a ball, can be any ball. If you've got like a weighted ball, that's brilliant. I haven't got one here, so I'm just using a little balance ball that I've been using for some other stuff. If you've got a tennis ball or a hockey ball or a squash ball, anything will work. So we're working a bit more dynamically now, working on coordination. Obviously squash is a sport that demands a high level of hand-eye coordination. So by doing this following exercise, we're not only loading the cuff tendons, but we're also now working on coordination at the same time. So we're going to be throwing the ball up and catching. Obviously the heavier the ball, the better for loading those tendons, but whatever you've got access to is fine. Now, if you really want to start challenging something that we call proprioception is essentially the body's awareness of its own position in space, something again that we really demand highly of in squash. Then we can start moving the body around at the same time, start looking in different directions, and then starting to coordinate the upper body with the lower body. Obviously with the shoulder, we never just use it in isolation, even if it's just as simple as picking something up off the shelf, we're using the whole kinetic chain, so the lower body at the same time. So what I like to do with these kind of exercises is add movement with the lower body at the same time. So we can start moving out to the side, almost working on those squash specific lunge patterns, going in with your left foot on the right hand side of the court and your right foot on the left hand side of the court. And after 1 or 2 minutes of doing this, you will really feel the amount of work that your shoulder's doing to keep stable. Okay? And the final exercise I want to work on for the rotator cuff tendons is something that involves something called perturbation. Now, perturbation is essentially an external force that is applied to a joint or a movement that maximises the amount of work it's having to do to keep stable. I've made it a little bit more squash specific, this exercise, so I've got my racket out and I'm actually going to perform a swing slowly. At the end of the swing, I'm going to have someone actually providing an external force to my arm to really challenge the amount of work it's having to do to keep stable and firm. Okay, so from here, I'm going to work on the swing, and then 5 seconds worth of fast, random movements to the shoulder. Once we've had the 5 seconds, I can return, re-perform my swing. If you really want to challenge your balance and proprioception at the same time, as I'm doing here, shut your eyes, and once you've done those 5 seconds, come back, and again, there. Notice how I'm trying to keep my shoulder relatively relaxed, firm but relaxed. I'm not straining it and bringing it up to my shoulder, up to my neck as so. Okay, so that's the stuff with the shoulder and the rotator cuff in particular. One of the other more common conditions that I regularly treat squash players for is tennis elbow, or a lateral epicondylopathy to give it its proper medical name. Tennis elbow is essentially an injury to the wrist extensor muscles, which originate at the common extensor origin of the elbow, approximately located at the lateral epicondyle of the humerus bone and the radial head. In my experience, there is a high correlation between this condition and a poor backhand technique. So those who do not cock the wrist when striking through the ball are placing themselves or placing their extensor tendons under a higher and less controlled load and are therefore more prone to tennis elbow. Therefore, in addition to these exercises, it might be worth taking a minute to discuss your technique with either myself, Malcolm, Jane, or any of the other fantastic coaches that we've got at the club. Similarly to the rotator cuff tendons, the purpose of the following exercises is to load the extensor tendons, the wrist extensor tendons of the elbow, so that they are able to cope with the demands placed on them during play. So, getting started, I'm going to do this in sitting. The first 3 of these are a little bit boring, I must admit, but they're quite useful to do. Again, I'm going to use a band, but this little weight can be held in hand and used at the same time, used instead of the band if you haven't got access to it. Similarly, a full water bottle or anything like that that you've got access to. So, this band is going to go underneath my foot. Wrapped around my wrist as many times as it needs to be. I'm going to rest my forearm onto that. There's many different variations in standing where we're incorporating elbow movement to these exercises, but I just want to keep it as simple and manageable as possible. And the first one I'm going to do is an assisted concentric wrist extension, followed by slow eccentric movement. So using your good hand, shouldn't really call it good hand, your opposite hand to pull upwards and then slowly letting that come down. If you want to know if you're doing it properly, once you've brought that wrist up, place your hand just underneath that bony bit on the outside of your forearm, and as you're slowly lowering it down, you should be able to feel that muscle, that tendon, actually lengthening under the load you're placing it through. So hand underneath, lifting, and slowly lowering down. As a progression on this, take the opposite hand out of the equation and just work on bringing that up and slowly lowering it independently without the assistance of the good hand. Okay, so ideally if you've got a table in front of you, that would be good. I don't, so I'm just going to have to go without. When I'm treating these kind of conditions, I try to include what we call supination and pronation of the wrist at the same time, because they do to a certain extent contribute in that sort of region. So wrapping the band this time around the top of the hand, and I figure out how to do that. Again, fixing with this opposite hand, and with this time I'm going to just roll the wrist outwards. Slowly bringing it back in, so working on that eccentric loading again that I mentioned before with your rotator cuff. And then also working on pronation, which is the opposite direction. For this you'll have to cross your arms over each other. Pulling into the band, adding a little bit of flexion in the wrist at the end. Pulling into the band, adding a little bit of flexion to the wrist. Okay. So those three, as I said, quite boring, but I wanted to add one that's a little bit more applicable, a bit more specific to squash. And I'm actually just going to practice some small backhand shots against the wall, but pay attention to detail a bit more to the technique involved. So, in terms of backhand shots, just thinking about grip to start off with, the way that I like to coach grip is that the grip comes from the first finger, the thumb, and the butt of the racket in the heel of the hand. So in that position there, that first finger acting almost as a bit of a trigger finger, both forehand and backhand sides. The third, fourth and fifth fingers essentially just sit on the racket for a bit of stability to make sure that the racket is stable as we perform. So that's the kind of grip I'd like you to adopt. So just to reiterate that, first finger, thumb, placed onto the racket as so, heel of the racket in the palm of the hand, and those three fingers just to stabilise. Okay? Keeping the wrist cocked into extension, as we call it, all the way through. I don't want to have people doing this in this position because you're more likely to place that under an unnecessary or abnormal load. In that cocked wrist position, we're just going to hit balls against the wall. Again, I'm lucky enough to have a wall. If you can find an alternative, then do so. So just from there. As you can see, my wrist is staying in extension the whole time, so I'm loading through those tendons in an appropriate way. And there's my few weeks off court coming into play. From there, try to keep the shoulder relaxed at the same time, just so we're incorporating a bit more squash technique into it. And that's ideal then, just for loading through those tendons. If you're currently suffering with tennis elbow, I'd probably advise against that because it might be a little bit too painful to cope with. But certainly if you're wanting to stave off tennis elbow, very good exercises to load those in an appropriate way, thinking about the grip, the wrist in an extended position, and the shots against the wall. So, the final thing that I'd like to discuss today is the small but very real risk of more serious injuries that can occur during squash, such as fractures or breaks to the proximal humerus and dislocations of the elbow. Now, these kind of injuries only typically occur through major trauma, such as a fall into the wall or onto the floor at high speed. However, I have witnessed a number of these freak accidents on court in my time, so I would like to pass on my advice as to how to minimise the risk of sustaining them. I would certainly advise plenty of balance work, so practicing a lot of balance work so that you are less likely to fall over while you're on court. Perhaps cast an eye over the more balance orientated lunge variations that we outlined in my first video posted last month. One of the key risk factors to these kind of injuries is the very natural loss of bone density that occurs at an accelerated rate after the age of about 35 and is even more significant in postmenopausal women. In order to reduce the rate at which we lose bone density and therefore minimise the risk of sustaining these kind of traumatic fractures, research points us in the direction of impact exercise and weight bearing. So the exercise that I'm going to show you for these, we're going to start out with a fairly simple press up. Different variations of press up that might be appropriate for different people that are watching the video. First one, I'm going to start off with just your knee press up. A lot of people can only manage this, and that's absolutely fine because we're still weight bearing through the upper limb. So as a knee press up, hands directly beneath your shoulders, onto your knees, and just coming down into your press up position. If you're able to, doing a full press up, so coming up onto your toes, again hands rather about shoulder width apart, and coming down into your normal press up. Keeping your tummy muscles tucked in all the while. And then if you want to add a bit of resistance to it, again, this is only really possible for those of you who've got access to a resistance band, but I quite like doing these press ups with the band tied around my shoulder, having a bit of tension within the band. So that I'm now also pushing up against the resistance of that TheraBand. Okay. So essentially the principle there is that we're loading through the upper limb, we're putting plenty of weight through the limb. The second thing that I'm going to show you, the second exercise I'm going to show you, is a little hop from side to side. This is where we're really starting to talk about impact going through the upper limb so that we are reducing the rate at which we lose bone density. So, on one hand, jumping to the opposite hand. There are different variations that you can apply to this. You might want to start with both hands on the floor, come down into a press up and hop onto a single hand. And then pushing into the final variation, which can be a bit challenging, is the clapping press up. Now, the emphasis here is not to show off the clap, the emphasis is to take the hands off the floor so you're then impacting through the hands and wrists. I'm going to start off with a knee press up to start off with, like we did on the first variation. Clap and back down, so we're impacting through those wrists. And again, if you can, into a full press up position. I'm just going to tuck this away. Into your full press up position, down, power pull up and clap. Okay. And I know that a lot of people that play squash, particularly those that have persistent problems with the wrists and the elbows, can't actually bear weight through their full body onto the floor. A wall press up can be applied. So basic wall press up, again, hands about shoulder width apart, and just leaning your body weight in so your nose touches into the wall, not letting your body fall inwards so that you're gently tucking in your tummy and pushing away. And then, so as to add impact, take a couple of steps away from the wall. You're now going to fall into the wall with your wrists and push away. Okay. Boxing can be a really good way of impacting through the wrists and hands, obviously. I don't have access to a punch bag or gloves and pads here, but I know a lot of people do. So any sort of boxing action where you're working on impact through the upper limb can be really helpful to slow down the rate at which we lose bone density. And research also seems to suggest that any contraction of a muscle, whether it tugs on the bone that it originates from, can also slow down the rate at which we lose bone density where it originates. So for example, if we were to contract the bicep and it were to tug on this bony process, it would slow down the rate at which we lose bone density around that bit of the shoulder. Therefore, in theory, any resisted exercise with band, with weight, with body weight can be useful to slow down the rate at which we lose that bone density and can therefore minimise the risk of those traumatic kind of fractures that we've just discussed. Okay, so please appreciate that the number of repetitions and the frequency of the exercise, while based on evidence, is largely dependent on the individual. So try to do what you can without forcing pain. Thanks for watching. Tomorrow we will move down the body and discuss common injuries of the hip and the knee.